Dilated cardiomyopathy, Marian Blakely. Gregory Smith is a 50-year-old man who views himself as just an average hard-working man who likes to drink after work. Mr. Smith says that he gives all to his wife and his children. He's been working at a financial institute for the last 20 years. He does have medical, dental, and a vision plan, but hasn't been to the doctor in the last 15 years. Mr. Smith states he's in great health and has never really been sick. He doesn't work out much, but he does try to watch what he eats, although his busy schedule doesn't really allow for the best choices. His father passed of a heart attack at the age of 62, and his mother is still alive. His mother has a history of hypertension, hyperlipidemia, and arthritis. Although Mr. Smith says he does not have any health history, there are factors that's impacted his health. He drinks a fifth of gin a day. He is a 1 pack a day cigarette smoker and occasionally smokes marijuana. He's not very active outside his normal routine and reports a recent weight gain, about 15 or more changes, but has not changed anything in his eating habits. Most of the weight appears to be in his lower extremities where he's swollen in his legs and have reported difficulties putting on his socks and shoes. After continuously noting these subtle changes in her husband, Mrs. Smith demanded he went to the emergency room. Presentation at the emergency room was shortness of breath, swelling, dizziness. There was a rapid and irregular heartbeat. Mr. Smith reports palpitations. There was also a cough that when he looked at the sputum, it was frothy and pink. Mr. Smith also reported that he had had a decrease in his urine output. Upon physical examination, it was evident that Mr. Smith was in some apparent signs of distress. His breathing was labored, and whenever moving around the table, he became short of breath. When vital signs were assessed, as noted, he was placed on 3 liters of oxygen by nasal cannula. Abnormal findings were presented within the respiratory, cardiac, abdomen, and in his lower extremity systems. When the heart beats, the muscles of the ventricles relax, causing the ventricles to expand, and the blood is taken out into the atrium. When it contracts, that blood is ejected out of the pulmonary arteries or the aortic to the lungs. This is how the blood gets oxygenated throughout the body. The systole period is when the ventricles are contracting. Systolic is when the muscles are relaxed and the ventricles get bigger. The blood is filling in the aorta and it's emptying. Complications in this process is what causes the dilated cardiomyopathy. It starts in the left ventricle and there is a pumping problem and the body begins to fill up. And in order to compensate for that, it becomes dilated in the ventricle walls. Laboratory tests can be done to help rule out other disorders and also to confirm a diagnosis. One of the most important lab tests to look at is a BMP, which determines if there is heart failure and how much the patient may possibly be overloaded. Presented to you are the abnormal values that were found for Mr. Smith. His BMP was extremely elevated, which showed possible heart failure with extreme volume overload. He was slightly anemic, and his electrolytes were imbalanced. Liver enzymes were correlated with signs of reported alcohol use. Additional diagnostic testing was done to help confirm a diagnosis. Chest x-rays can be used to assess for enlargement of the heart, congenital malformations, or abnormal shaping of the heart. An EKG can also show for arrhythmia. It can also identify blocks or delays. One of the single most tests in the diagnosis of suspected dilated cardiomyopathy is an echo. During the echo, valve functions are checked, an ejection fracture is determined, and it can be identified if the ventricles are dilated. It gives the best view, and it is the golden standard for assessing left ventricle functions and diagnosing dilated cardiomyopathy. Because there is not one specific test, each test has a unique purpose in helping to confirm a diagnosis. Chest X-ray helps shows a visual picture of any type of deformities, while EKGs can show rhythm, blocks, or delays. And as stated, the echo shows the size and the function of the heart, and the ventricles can be measured. This flow chart shows the progression of dilated cardiomyopathy. It shows the decrease in the contractility, decrease in compliance to the mitral and the tricuspid regurgitations, and just shows the process of the flow that I'll go into deeper as we progress. When the heart muscles do not form properly, they're not able to contract. Those muscles begin to get thinner and thinner and are unable to eject the blood out of the ventricles. As more blood remains in the ventricles, decreased amount is allowed to flow in the rest of the body. This causes a decrease in the ejection fraction. To compensate for it, all of the chambers eventually begin to dilate. There's a certain amount of blood that's needed for every contraction. With this reduction, it gets a lower volume. So if you've got a decreased amount that you're putting out, then there's a decreased amount that's flowing to other parts of the body. This gets worse, and the aortic begins to become dilated as well. If it continues and not treated, heart failure develops. When this change is developed alone, it's called a primary, and all four chambers begins to get larger. New cells are added in series, and they grow larger but weak with each contraction. Less blood is pumped out, causing a lower stress volume, which can result in hypotensive and eventually resulting in heart failure. The valves are stretched as well, and blood begins to leak back into the body, causing edema. There are various causes of dilated cardiomyopathy, but some reasons and the primary reasons are unknown. A few of the causes can be autoimmune diseases, pregnancy, hypertension, but it has never resulted from ischemic heart disease, valve disease, nor hypertension. It is the primary disease of the heart. Gene mutation and infection are also causes. Chemo drugs and cocaine and meth have also been related to dilated cardiomyopathy. It's also seen at the end of pregnancy or the weeks shortly after after pregnancy and the period of hypertension, the heart normally recovers and returns back to its normal function. Alcohol abuse is a common cause found in men. It's important to know who is at risk, when to treat, and how to treat to help sustain a quality of life and prevent heart failure. Depending on symptoms presented and the advancement of the disease, there are various types of treatments to be used. The clinical plan for Gregory would be to admit him to the hospital to help relieve some of the symptoms of his clinical manifestations. He will be diuresed to help reduce the fluid overload and begin the education of his new lifelong medicine regimen. Education will be provided around smoking and alcohol counseling. There's many important life changes that must be made for anyone with this new diagnosis. Following through with a healthy diet and preventing the factors that created the problem are essential. Gregory would need to find a PCP and a cardiologist to help manage this disease process in order to improve his quality of life and have a long, healthy life with his family.